Hi, my name is George Wu, and I want to share with you a very interesting case of localized cystic disease of the kidney. Patient was a 6-year-old boy who presented to the emergency department with gross hematuria. He had no history of trauma, and a review of the imaging records showed normal prenatal ultrasounds. Renal ultrasound showed a complex multiseptated mass involving the upper pole of the right kidney. Pre- and post-contrast CT images again show a cystic mass in the upper pole of the right kidney. A focal hyperdensity within the lesion likely represents protein or hemorrhage. The cystic mass in the right kidney shows many enhancing septations, ranging in thickness from thin to thick. Some of the thicker septations, like the one here, turn out to be normal renal tissue. The cystic mass does not show a wall or enhancing nodules. The final diagnosis is localized cystic disease of the kidney, which is a cluster of renal cysts without a defined wall or capsule. Multiple septa-like structures are identified between the cysts, which are actually just normal intervening bands of renal parenchyma. Generation of a differential diagnosis is guided by first classifying the cystic lesion according to the most recent 2019 Bosniak classification. Our lesion can be bucketed into the Bosniak 3 classification, which is defined as one or more enhancing thick, greater or equal 4 mm width septa. Some typical Bosniak 3 lesions are listed below. Multilocular cystic nephroma has a peculiar demographic predilection for boys younger than 4 years or middle-aged women. Imaging shows a cystic mass with a wall and variably enhancing septa. The lesion can herniate into the renal pelvis or proximal ureter. Our lesion does not have a wall. Cystic renal cell carcinoma is a cystic renal mass that cannot be differentiated from other complex cystic renal lesions on imaging. The older median age helps to identify this carcinoma. Mixed epithelial and stromal tumor is a cystic renal lesion that predominantly affects females 11 times more than males. Localized cystic disease of the kidney is a rare, non-hereditary, benign renal entity. Few cases are described in adult literature and even fewer in children. The pathogenesis is unknown. This entity is characterized by replacement of various amounts of one kidney by multiple cysts, which may involve a localized portion of the kidney, but can be scattered diffusely throughout the kidney. In some patients, the lesion is incidental. In others, they may present with hematuria, flank pain, palpable mass, proteinuria, renal stone formation, or UTI. Imaging features involve identification of clustered renal cysts separated by normal renal parenchyma without a wall. The absence of a wall or capsule allows the normal renal parenchyma to insinuate itself between the individual cysts. However, in real life, the diagnosis may be tricky in that the intervening renal parenchyma may be so thinned out that it may simulate enhancing septa of malignant cystic renal lesions. Second, tight spacing of the cyst may also obscure the evaluation of a cyst wall. It is suggested in the literature that evaluating the kidney in the coronal plane allows for better visualization of the normal insinuated renal parenchyma. LCDK is a benign entity with surveillance imaging proposed for equivocal cases. In clinical practice, it may be difficult to accurately separate out the multiple differential diagnoses of a Bosniak 3 renal lesion, given the overlapping imaging appearances. Bosniak 3 lesions have an intermediate probability of being malignant. Thus, these patients often undergo surgical resection.